Oh my God, the skin is just like ripping off. Imagine being trapped alone inside a tiny submarine at crushing depth. But instead of water outside, it's an ocean full of radioactive human red stuff. Today, we're reacting to Markiplier's highly acclaimed film, Iron Lung, and breaking down the real medicine behind this nightmare scenario. Let's dive right in. Oh. Cool and creepy. The submarine seems to be deteriorating and the air filtration system doesn't seem to be working the way that it should. Leaking of oxygen, it starts to panic, get confused, maybe a little disorientation. And this actually does happen. We see this in the hospital, different stages of respiratory issues that you can get. You might have an environment where you're not getting oxygen in. You're hypoxic, which is decreased O2. Could be related to pneumonia, a collapsed lung, really bad infection, sepsis. We need to give supplemental oxygen.
I don't know. Was that you?
There's something where CO2 builds up and we call it hypercapnia. As your CO2 builds up, you become respiratory acidic, meaning your blood pH actually starts rising, you get more confused, very lethargic, tired, and then your drive for breathing actually significantly
starts to slow down.
Is it? You didn't tell me that there would be anything down here.
Your oxygen is starting to go down, your heart rate goes up, you get lightheaded, you get dizzy, you might even become cyanotic. Fingers and the toes start turning like blue-purple, even around your lips and the mucous membranes.
There's a problem with this because if you fell, the hull could be punctured, which means a leak, which means flooding, which means you die.
We'll see individuals where they have COPD, chronic lung disease, so their oxygen levels are always a little bit low, and we want to make sure that they actually stay a little bit low, because if we actually give them too much oxygen, then they don't have a drive to breathe. So when you become hypoxic, you actually will work hard to breathe.
So what's the deal? Am I done?
How's your oxygen? See any leaks?
Yeah, I'm down a light, but yeah, maybe there might be a leak. There was some blood dripping in.
Locked in this, you don't know, daytime, nighttime, your circadian rhythm gets off, your sleep patterns are off, cortisol levels are all over the place, you can get super confused, altered, depressed, your body starts to break down in and of itself just being in this type of environment. Whoa. Whoa. We got x-ray, we got bones. You see the appropriate bones of someone's hands. We have a radius and an ulna. You can see part of the humerus as well as the facial skeleton.
Are you out of your mind?
Oh, good. You can hear me. I'm not going.
Blast us with radiation, you psycho-eating.
She's talking about radiation exposure, people getting lots of CT scans. We worry about the potential of DNA damage, basically, and cancer formation many years down the road from it.
Not a normal camera. You can't see through blood, so you need x-rays to get through.
An x-ray has very little radiation exposure. Maybe a couple plane rides would be equivalent to an x-ray versus like a CT scan. It's like hundreds of times more radiation exposure. Getting up, confused, maybe the oxygen is going down, so you can decrease oxygen levels and higher carbon dioxide levels, or he's just in shock of what he's actually seeing. We'll see patients behave this way as well, where they're just a little bit out of it, have this blank stare. He's in an ocean of blood. Some cracks, some seeping in could be a source of infection. We have bloodborne pathogens, and that's why we need to wear our PPE. The more common ones that we have, HIV, hepatitis B and C, those are the ones that we do worry about. People get bacteremia, where the bacteria is actually in the blood. Significant sepsis that is very common is E. coli. We have to treat it with appropriate antibiotics. The question is, if I'm in a pool of blood, could I breathe the blood to get oxygen to my tissues? And the answer is no. Bandage on his arm could be related to tissue breakdown, oxygen deprivation versus radiation exposure, because you can have cutaneous effects of it where you get blistering, skin breakdown, opening wounds. We actually see non-radiation type blistering, skin breakdown all the time. You can have an infection of your skin, a significant amount of peripheral edema that actually opens up your tissues. We actually see non-radiation type blistering, skin breakdown all the time. You can have an infection of your skin. You can have a significant amount of peripheral edema that actually opens up your tissues. What are we seeing? Oh, we're seeing leakage. Oh my gosh, what is all this? Looks like there's leakage coming into the submarine, and we're seeing this weird blood corrosive, like stringy stuff. Blood actually will do this when it starts to clot. It'll actually clot in like lines and balls and different shapes, and it's actually doing kind of this similar thing, even though it looks more like it's an alien taking over. Blood dripping on him, so as I said, increased risk of blood exposure. It gets into your eye, it's absorbed very fast. Oh, somehow it caused a weird laceration, crack to his forehead down. We don't see a lot of lacerations going down like that sometimes, but usually it's more lateral. It's actually pretty easy lacerations to fix. Sometimes people don't even want sutures, they want glue. For this one, that's almost the whole length of his forehead. You probably would use about 6 stitches, most likely. These bandages, they almost look like cloth bandages. You got to be careful when you put these type of bandages on the wound, and say the wound starts to dry out. It's going to stick to your wound. So when you actually try to take them off, it's going to rip the tissue, rip your scab. Most of the time when we actually put a bandage on an individual, we will use non-stick. Like this, where you, oh my God, the skin is just like ripping off. That's probably going to test someone's ability to stay calm. Thankfully, most of us aren't dealing with that level of stress, but for everyday stressors, I created Chillax by my company Life Happens, designed to support relaxation and calm focus when life gets intense. Check it out at lifehappens.com or on Amazon. We're having like skin breakdown. You can see the blistering and the bubbles. All open wounds. Chemical exposures can do this. Significant amount of edema to these tissues can cause this. Exposure probably is related to the blood ocean, where chemical and biological corrosive. So it actually is almost like a burn, which we see people who get 2nd-degree burns will get blister formation like this. When you get a blister from a sunburn, it's just the fluid. You're not getting blood. Versus here, you're getting blood exposure. So you're getting into the capillary tissue, deeper layers of skin. If there was an exposure, you need to get whatever is on the skin off. There are some chemicals that actually need a reversal type chemical agent to be put on there so you don't have further damage of your cells. Burns due to radiation could be affecting the basal cell layer. Basal cell cancer, it's usually from UV radiation exposure and damage to your skin. The basal cell, it's the deepest layer of your epidermis. So you have your epidermis, your dermis. How this progresses, typically you get erythema, which is like the redness of the tissue. That tissue starts to like slough off, and that's actually a fancy medical term that we call desquamation. And then you start having significant amount of pain and bleeding. Blood vessels are exposed and nerves are exposed. If you wanted to fix this with skin grafts, with these radiation burns, it could happen, but it all depends on the type of damage that is going on. If you're not having any blood supply to allow that graft to heal, it's not going to fix itself, versus with regular burn tissue, it's at certain layers to where the burn surgeon can get your tissue to heal itself with an autograft or a donor graft or fish skin. Super cool. You see the iris change colors. Most people's irises don't change colors like this. Usually if you're having redness to your eye, it's usually to the white part of your eye, sclera. But some people's irises do change a little. Mine are brown and green in the same eyes, and sometimes it's brown, sometimes it's green, just depends on the day. Oh, we're losing pressure. Oh geez. Oh, now he's gonna have a significant amount of exposure. Oh, it's like pouring in. Same idea with exposure to water. Fluid in your lungs, it's not allowing gas exchange. You're gonna become hypoxic and not be able to get oxygen to your tissues, and your tissues are going to die, meaning organs, brain, kidneys, lungs. These are all very important organs that you need. Whoa! Those all look like clots to me, but I know it's not clots. Is that his arm? Oh, wow. Broke down the tissue so badly that it almost like ate it away. Even broke down the bone. So we have bone exposure here. In this scenario, if somebody came in with bone sticking out further than the tissue, what do you have to do? You actually have to cut the bone off more. Cut it far enough back that you have enough tissue to go over that area. I don't think he's gonna make it. He's drinking a lot of blood, not just inhaling it, but also probably swallowing it. When you swallow so much blood, you increase the risk of swallowing like the components of the blood. So you can get hemochromatosis, which is basically when you're getting so much iron into your system and actually starts messing with your other cell functions that are going on in your body. Oh, there it is. The submarine has been destroyed. Whoa. Typically when it's deep into an ocean and the hull has then lost its integrity, 1,500 pounds of pressure per square inch is probably going to now take its full effect on your body. It can cause almost instantaneous type damage to the person. This is crazy. This show is nuts. Good take on like blood and different theories. I have to definitely check out this movie. If you guys enjoyed this, definitely check out this playlist right here. Please binge watch everything. And as always, do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.